Hi, my name is Chris Thurstone, and I'm a child psychiatrist and addiction psychiatrist. And I'm here to tell you about a project we're working on called Keeping Kids in School. So, adolescent substance abuse is a big problem in our state and in our city. We know that about 7% of all 12 to 17-year-olds in Colorado have a full-on substance use disorder or addiction. We know 27% used marijuana in the last month in Denver County. We know that 20% of Denver public school high school students got drunk in the last month, 11% smoked a cigarette. We know that 15% of Denver public high school students seriously thought about suicide in the last year, and that Denver public schools had about 763 drug-related suspensions last year. And we know that the cost of adolescent substance abuse is very high in terms of being associated with aggression, school dropout, addiction. We know that the earlier people start using substances, the more likely they are to become addicted. Adolescent substance abuse is associated with truancy, teen pregnancy, risky sexual behaviors, with serious mental health problems such as suicide, depression, anxiety, subsequent onset of schizophrenia and psychosis. Adolescent substance abuse is associated with delinquency, and more data are coming out showing that adolescent substance exposure is not healthy for brain development. So, all in all, adolescent substance abuse presents a high cost to our community. Now, one of the problems about adolescent substance abuse is that only 1 in 10 teens who need substance treatment actually accesses care for their substance abuse problem. So that's a very small number who are actually accessing care. And if we were talking about cancer or heart disease or diabetes or any other medical condition, this treatment gap would just not be tolerated. In terms of more bad news, when youth do access substance treatment, they rarely access comprehensive treatment that addresses both their mental health and substance abuse needs. So only 1 in 4 adolescents who is in substance treatment actually gets the kind of care they need addressing both mental health and substance problems. And so a lot of research has been done in the last few decades to try to develop new treatment models that can address the whole adolescent presenting for substance abuse treatment. Nevertheless, we're still left with a situation where very few people are accessing this treatment. So this led to the idea of taking treatment to where the kids are, which is in school frequently. So Denver, the city of Denver has 17 school-based health clinics, and this is a perfect setting for providing the substance abuse treatment in a way that's actually accessible to the youth who need it. So over the last few years, Denver Health has developed several community partners to start providing this substance treatment to adolescents in 3 of the 17 school-based health centers. And this treatment's been up and running for the last year, and we've seen 71 youth so far. And these are some of our results, the mean age being about 15 years of age, mostly male, although we're seeing more and more females. The most common substance that brings the adolescents to treatment is marijuana. And a really important finding under psychiatric diagnoses is that a full 41% have current post-traumatic stress disorder, and a full 41% also have a current major depressive episode. And so we know it's very difficult to get clean as it is, much less when somebody's in the middle of a major depressive episode, for example. Scrolling down to the bottom of the chart there, you see the mean grade point average on a 4-point scale is 1.43. So a lot of these youth are really struggling academically. And the mean number of unexcused absences from class per day in the last month is just less than 1. So again, underscoring the significant educational problems that these youth have. In terms of our outcomes after treatment, you see the baseline there in the second column, and then end of treatment in the third column. And so the mean proportion of days used substances significantly decreases from baseline to the end of treatment. Depression scores significantly decrease from baseline 13.9 to 7.9. So 13.9 is in the clinical range and 7.9 is well below the clinical range. Similarly, PTSD scores or post-traumatic stress disorder scores decrease from baseline to end of treatment significantly in a good direction. Anxiety scores are also decreasing, although the statistical p-value is not significant there, probably because of the small sample size. ADHD scores decreasing from 34 to 18, so 34 is moderate range, 18 is considered subclinical, and that was a significant change. And then 32% of youth having a full month of confirmed abstinence from substances by the end of treatment. So ultimately, with these initial findings that show that positive results from treatment, the end goal is to try to get into all 17 school-based health centers. And if we do that, we will provide services to just under 700 youth per year. And if we do that, I think we can make a huge dent in the problem of adolescent substance abuse in our community and all of its related problems, including aggression and delinquency and truancy and school dropout as well. So thank you for your time.